So the question is that the bill be now read a second time, and I'll give the call to the member for Fowler.
Thank you, Deputy Speaker. I rise to speak on this Aged Care Bill 2024 second reading. Look, in July this year, I had the Lansdowne Aged Care facility organise some of their residents to come to Parliament to visit our Parliament. And it's the first time ever that Lansdowne Aged Care have brought their residents here, and they wanted to expose their seniors to, obviously, the workings and Canberra in Parliament. Organised by their manager, Nam Pham. She reached out and she said, "Do you think it can happen? Make it happen." And I did. I brought 4 elderly ladies, a couple in the walking stick and walking frame, up to the members' dining room and hosted them to a nice lunch. It took them 3 hours to drive from Cabramatta to Parliament, and we were hoping to get them into question time, but that 3 hours drive and the whole experience in Parliament was just so overwhelming. After lunch, they drove back home. But it was a great experience for them, a great experience for Lansdowne Aged Care Facility to really see Canberra and the Parliament House. Lansdowne Aged Care Facility it caters to our culturally and linguistically diverse community, in particular Southeast Asian residents who have got that cultural needs in terms of their food and their care, language in particular as well. I engaged with the Lansdowne Aged Care Facility when the exposure of the draft of this bill was released. I reached out to them, including other community providers, workers, as well as nurses from in the system to get their feedback on what is working and not working. Nurses who came to the forum were visibly frustrated with the understaffing with aged care. A nurse who attended the forum shared, this is what she said: "There's a growth in aged care residents from multicultural backgrounds, yet there is a lack of nurses with the appropriate language skills to ensure the residents' needs are supported. This is a gap." Another nurse said, "I want to do my best so each resident receives the care that they need, but there are only a few of us at a time. To be honest, the aged care sector is not really that attractive." Nurses are the cornerstone of a functional aged care system and any health system for that matter, but they do not feel sufficiently supported. Whilst there are current incentives available, there must be further conversation on how to better support nurses and in turn effectively assist our older people within aged care. Overall, I had voices from providers, nurses and children of individuals share about where our aged care system has gone wrong. It was a mixture of different pain points: aged care residents not having their needs adequately addressed, the lack of nurses wanting to work in aged care, understaffing, juggling competing demands, certain aged care providers not doing the right thing, the minimal resources, the lack of training to address the complex needs of aged care individuals of culturally and linguistically diverse backgrounds, and compliance, the filling of paperwork, the demand on providers to provide that rather than focusing on the individual care. The list goes on. In my door knocking, I came across elderly people who chose to stay home because their children feared that the aged care homes will fail their elderly parents. For example, I met Mrs. Kwang, who is 104 and still living independently. I know, independently and in her home. She lives on the 3rd level of her block of Karama, a block of unit in Karama. And I was so surprised because when I door knocked, it opened up, and there she was with her son sitting there. And apparently, the children takes turn in coming, cooking for her and cleaning for her. But I was just so amazed, this 104-year-old sitting there in her bed on the 3rd floor of her block of units in Karama. So I've also visited many other nursing homes within my electorate to speak to aged care residents to understand the state of our aged care system, and found that some of our aged care facilities in Fowler, they provide the professionalism, the staff provide them with so much care, especially speaking the language, providing some of the food that's needed, the cultural food. And I know if you're coming from a culturally, linguistic different background, it's very important to have food that you grew up in. grew up with. And so some of those areas are working for them. So the population of people aged 60 in Fowler in 2021, according to the ABS, was about 39,498 people, which is more than 20% of the entire population of Fowler. As of June 2023, there are 28,648 recipients of aged care services in southwest Sydney. The cohort of ageing population will only continue to grow. Constituents have attended my office and written in about the issues with the aged care system on behalf of their parents or loved ones. Interestingly, a young constituent named Jennifer wrote saying that I would never put my parents in an aged care facility as I heard it is full of substandard care and even neglect. My parents cannot speak English well, so it's more concerning. I think this is a stigma that the aged care system is currently attached with, the distrust, incapable and not fit for purpose. The issues and concerns shared were not far from what was found in the Royal Commission into Aged Care Quality and Safety report. Deputy Speaker, there is a lot to unpack with the Aged Care Bill. I understand that the Aged Care Bill will address 60 recommendations of the Royal Commission's report and the final report of the Aged Care Task Force. The bill will establish a modern rights-based legislative framework that focuses on the safety, health and well-being of older individuals and places their needs at the centre of the aged care system. I'm glad to hear that this approach will be taken, and I commend the government for following the Royal Commission's report's recommendations in drafting the objects of this bill. It is crucial to get the objects of this bill right to set the scene for an aged care framework that's workable, sustainable and trusting. If we all put ourselves in the shoes of those needing aged care, because we will all age and in need of aged care one day, and so wouldn't we want a system that has a high level of service and care that would ensure individuals accessing aged care services are free from mistreatment, neglect, harm, is accessible and more? Surely we all would want a system of aged care that is of the highest standards. However, as my constituent Jennifer shared, it is important to ensure that individuals of diverse cultural and linguistic backgrounds' needs are being addressed and that they do not become unintentionally neglected. Whilst the object does provide for an aged care system which takes into account the needs of the individuals first, regardless of their location, background and life experiences, I urge the government to clearly stipulate that the new aged care system will ensure that the needs of culturally and linguistically diverse people are also being effectively accounted for. When speaking to my constituents, it was a common theme that they wanted an aged care system which supported their ability to live at home safely. This was particularly relevant to older people who came to Fowler as refugees and migrants and have invested their whole life working to buy their family home, so there is an undeniable attachment. Again, in my door knocking, I have met so many seniors living at home and being cared for by their loved ones because they believe that our aged care system doesn't cater to their cultural needs. This is where our home care package is crucial. The Royal Commission's report revealed that, quote, older people are not getting the home care package at the time and level needed, with a wait time to be as long as 34 months, that's about 3 years, for those with the highest needs. This meant that the people could literally die waiting for a home care package. The report also found that the home care packages were insufficient to meet the needs of many older people, such as the highest level of care only getting 8 hours and 45 minutes of service per week. This is disappointing to hear. I understand the government will be introducing a new support at home program, replacing the home care packages and short-term restorative care to the tune of $4.3 billion, which works out to be about $19 per person. This is supposed to include more tailored support determined at assessment and 8 ongoing classifications instead of the 4 home care package levels, starting at $11,000 to $78,000 a year for the top classification. These figures might make sense to the policymakers who develop them, but the critical point will be, will this new program provide adequate care for our ageing population? Not only that, but the government will ensure that this latest information. Not only that, but the government needs to ensure that this latest information is clearly explained and provided to those in culturally and linguistically diverse communities in Fowler and across Western Sydney. Too often, when the government makes policy decisions and changes from the ivory tower of Canberra, by the time it gets to where lives matter, the information gets lost in the lack of translations and practice. Home care services reported that the largest proportion of recipients were those with the preferred language other than English. Will the government ensure that the brochures are circulated in various languages to assist older individuals navigate the new support home care program? There will be new rules for aged care providers and workers. Aged care providers will be required to apply for registration, which will be decided by the Commissioner. There is also a separate set of obligations on aged care workers and responsible persons of registered providers to comply with the aged care code of conduct, failing which will incur civil penalties. This is in line with the recommendation 92 of the Royal Commission's report. There is pressure for the aged care providers to do the right thing or risk a high civil penalty or losing their registration. Aged care providers who attended my aged care forum shared two primary concerns regarding the aged care bill during the exposure draft: financial sustainability for providers to meet the compliance requirements and whether it would lead to uninsurable risk, such as that providers will not be able to obtain insurance due to the high civil penalties. To be clear, I think the new aged care system must have strengthened compliance requirements for aged care providers to ensure that individuals accessing the service are not subjected to harm or neglect. Providers doing the wrong thing need to know that there will be dire consequences under the aged care reform. However, there must be a balance and a compromise with key stakeholders such as providers for a long-term and sustainable reform. We do not want to be in a position whereby older people will not be able to access the residential care and support that they need because providers would not be unable to support their operations. And we do not want to burden providers with excessive bureaucratic demands of filling out paperwork instead of focusing on what they do best, which is to provide care for our loved ones in an aged care facility. This aged care reform is critical for Australians, and I welcome the government's efforts in taking the steps to respond to the Royal Commission's report for a better aged care system. Aged care being a rights-based model is a step forward. I iterate that it is important that these reforms be explicitly inclusive to the needs of the culturally and linguistically diverse ageing population, especially those in my electorate of Fowler. Deputy Speaker.